Shifting our focus now, Israel is confronting a growing psychological crisis inside its military ranks. The death of a young former soldier has pushed the spotlight onto the mental toll of Israel's wars, with official data pointing to a sharp rise in PTSD, that's post-traumatic stress disorder, depression, suicide attempts, and eventual suicides. Among Israeli troops fighting across multiple fronts, remember, at least 10 Israeli soldiers have reportedly died by suicide since the beginning of the year, including 6 in April. A 23-year-old American-born former IDF combat soldier, Alex Miller, has died in an apparent suicide in Miami after reportedly battling post-traumatic stress disorder linked to his military service. The case has renewed focus on Israel's worsening military mental health crisis. Data released earlier this year by Israel's defense ministry showed that PTSD cases among the Israeli troops have surged nearly 40% since September of 2023. The ministry has warned that the number could climb by as much as 180% by 2028. Israel's defense ministry says more than 22,000 troops are receiving treatment for war-related injuries, with nearly 60% suffering from post-traumatic stress disorder. Healthcare provider Maccabi reported that almost 4 in 10 Israeli military personnel under its care sought mental health support in 2025, while more than a quarter reported symptoms of depression. An Israeli parliamentary report found that at least 279 soldiers attempted suicide between January 2024 and July of 2025, marking a steep increase from previous years. Combat soldiers accounted for 78% of all suicide cases in Israel in 2024, as compared to just 17% in 2023. According to Israeli newspaper Haaretz, 22 active duty IDF soldiers died by suicide in 2025, which is, remember, the highest number that has been recorded since 2010. The numbers reflect the growing crisis within the IDF, even as Israeli soldiers remain engaged on multiple fronts, including in Lebanon, in Gaza, and Syria. Mental health professionals say that soldiers involved in combat grapple with overlapping forms of trauma, including fear of death and trauma, as well as, of course, the potential damage that is done to a person's conscience. As per reports, access to care remains a major hurdle for Israeli soldiers who must appear before a defense ministry assessment committee, a process that can take months. The demand for mental health therapies also reportedly outnumber the existing capacity.